But what is a treatment setting? This is what we refer to as specialized substance abuse treatment. It's a place or environment where substance abuse treatment services are provided. Typically, that can be in a residential setting, though we really strive to provide what we call a less restrictive setting. When we mean restrictive, that's really the degree of physical and social structure provided by the staff for the recovering substance user. So various programs will be restrictive based on what's allowed, what's not allowed, what type of regimen they have. But for the most part, when we say restrictive, it means what type of privileges and what type of structure is involved. We're going to begin with what is probably the most restrictive setting, and that is medical detox. Detox is not necessary in all cases. Detox is really for medical necessity, which will be when someone is probably experiencing really, really severe withdrawals. And if those withdrawals could be life threatening or cause some type of really serious medical complication, we want to go ahead and have them referred into medical detox. Not all substances require medical detox for treatment. Um, the most common, though, are probably going to be opiates, alcohol, and sedatives. Very much so, like probably uh, Xanax, benzodiazepines, that kind of thing. Length of stay in detox is really short. It's less than 2 weeks. I personally have heard probably the longest stay in detox would be about 10 days, but it's usually less than that. It's probably usually only 3 or 5 days. And the whole goal of detox is to just have the person medically supervised so that they can manage their withdrawals. And that's really it. You don't want the withdrawal to overcome the person. And it's an important point down at the very bottom. Detox is not comprehensive treatment. In other words, just going to detox and spending those 3 or 5 days, and which usually something like a medical facility, it's not comprehensive. It's not very life changing, but it will again just make sure that the person gets off of the substance with minimal withdrawals. And then the next setting is the freestanding rehabilitation programs, which is very common. These are the quote unquote rehab centers that we've all become familiar with, either through movies or TV shows, or maybe some of us know someone who's been admitted to these type of programs. A couple of things to clear up about residential treatment: it's not medical treatment. Most of these programs are operated by counselors. There's two long-term treatment goals. This is according to the Minnesota model, which was uh, one of the first residential treatment programs was at Hazelden, which is a very famous center now. If you want to Google Hazelden, I'll probably include some supplemental material about Hazelden. It's one of the oldest residential programs, and the goals are total abstinence and an improved quality of life. This is where a person will spend a lot of time, but not as much as they would in the past. Typical lengths of stay now in residential treatment are about 2 months, maybe a month at the most. In the past, those stays could be up to maybe 3 or 6 months. And a lot of people feel like, you need to spend 3 or 6 months in the residential program in order to truly change, but that is not the case. You see, you could have just as much of a change and just similar results with only a month. So they would have a very structured schedule of treatment, usually from morning to evening, counseling throughout the day. And if you read the textbook, just keep in mind that which is typically up to 4 months to a year, that's really not the case anymore. There have been drastic cuts in things like insurance and funding. People will really not stay there up to that long. Again, the typical stay now is 1 to 2 months. Take a look here. There's all types of therapy, all types of treatment that's available for a person in residential care. The next treatment setting is really something that's atypical. You don't see it that much, and which is called partial hospitalization. Partial hospitalization, it's like day treatment where a person will probably spend a couple of hours a day at a treatment site, but um, probably go home. It's not very restrictive at all. It's something that's very atypical. You don't see it that often. Think of it as like maybe you'll know of a relative or someone who spends a day at like an adult daycare facility where they receive daycare. That's really what this is. This is a different type of setting. This is recovery homes or sober living homes. For those of you who are unfamiliar with sober living homes, um, they're a typical place where people stay and receive support if they're in recovery. This is usually for someone who has already been at at a some type of a residential program and detox. And they're coming out and they need a place to stay. If mostly though, if the environment in which they originally came from was not an environment that's conducive to recovery, so if there's a lot of drug use around there, family members usually, then that's usually where somebody will seek sobriety homes. The whole goal of recovery homes or sobriety homes is to remain sober. Everybody is accountable to each other. It's run and operated by people who are in recovery. There's no counselor there. There's really no type of single authority figure such as that. It's just for someone who wants to stay in a sober environment. If people pay rent, it's just like having an apartment, having roommates. Um, Here in the Rio Grande Valley, a we had actually two recovery homes. At this point, I believe there's only one now, which is in McAllen. We used to have one in Brownsville as well. I think it shut down, but it's a great alternative. Intensive outpatient. Intensive outpatient is probably the most common type of treatment available, and it's very common because it's also very effective. Intensive outpatient is when someone would go maybe to an outpatient setting, usually with a counselor, and they would receive treatment on an ongoing basis several times a week. They would go in for appointments, see the person, but they wouldn't stay there. So it's again, the restrictions are lessening more and more so. Typical stay in outpatient is about 90 to 120 days, which is, think about this, that's usually the equivalent of, say, the amount of therapy or treatment they would receive in a residential program. Traditional outpatient is a little way different than what we consider outpatient. If you speak to somebody about outpatient, they're probably referring to intensive outpatient, but traditional outpatient includes something like a DWI education program. These are places where you'll go probably once on a weekend or a couple of days to receive education, and that's it. You won't return. Not much treatment happens. It's not really treatment at all. It's more of just an education setting, a psychoeducation setting, which is where they'll learn about impairments related to driving, blood alcohol levels, that kind of stuff. So some of y'all might know someone who's attended something like this. It's not treatment at all. It's actually just education. So that was a very brief overview of the different types of treatment settings. You really need to read the textbook to get a better sense of how each one of these settings are different from each other. I'm going to spend just a few minutes discussing treatment planning and what exactly treatment planning is. Treatment plans are documents that detail how problems are defined and treatments are formulated for the substance user. They are updated as needed. Some of you may have had a course, say in like case management or something very similar, where you've talked about either treatment plans or service plans, and that's exactly what these are. For the previous draft assignment, you had to kind of develop a treatment plan for your pseudo client, and this is exactly what you would be doing. You would be creating a treatment plan which addresses the problems of this person and how you, as a counselor or whomever the counselor would be, will probably approach these and what type of therapy you're going to use. And treatment plans are very beneficial because you cannot just start uh, conducting therapy on a client just on a whim. You actually have to have all of your therapy sessions planned out. A very detailed treatment plan will include everything: the beginning sessions, later sessions, what you hope to accomplish from these sessions, so on and so forth. You can't get away with just willy nilly, just setting up whatever type of treatment you want. That's not really allowed by things like, uh, you know, uh, insurance companies. Now we come to the end here, and there's a couple of things to remember about treatment planning. The person, the client, is always involved or should always be involved in the treatment plan process. So having them provide you input is necessary in the treatment plan. Sometimes it's unethical to just write it all without the person acknowledging what they need to address. So, in other words, you have to have the client with you to write the treatment plan. You can't just write it on your own and give it to the client and order the client and you tell the client that this is the treatment plan that you're going to follow with him or with her. They have to be actively involved. The diagnosis is these are different elements that are usually included in a treatment plan. There's a really good sample if you have the textbook on page 171 and 175. You can also find different types of treatment plans online. Just look through them and give them a good skim, and you see that some treatment plans are typically similar. There's a plan there's especially with the different types of treatment services that are going to be laid out, a diagnosis for the problem, the symptoms, any other types of problems to address, social problems, and then you'll sign it. It's actually a binding document. All right, hope you enjoyed this lecture.